As you could see from the title of my presentation, what this talk about is, it's about an asthmatic youth that grew up in Western Connecticut on a farm, who actually grew up to be a technologist to work with health professionals to tell engineers, scientists, and planners how to do their job. So it's been kind of an interesting career. There's a lot in the story there, but the actual story is about 5 years worth of work that we've been doing, where I've been able to relate to taking some of the symptoms that I've grown up with in my life and trying to apply technology to better solve some of those problems that exist. So the area that I'm going to talk about is one I haven't heard talked about much here, which is around health and the effects that the built environment are having in health. And there are a number of factors that affect health. I could go on and on about all of the factors, but one of the biggest factors is family history. In my case, both of my parents had asthma. Luckily, my older brother did not have asthma, but I statistically did have asthma that were there. He was the less than 1% that didn't get it when both of your parents have asthma that are there. Both of my parents also have high blood pressure, so I have an 85% probability of having high blood pressure when I grow up that's there. But there are things that I could do that could actually change that. And that's one of the things that is the biggest factors that are actually affecting some of the decisions that we're making. So the behaviors that we take, the lifestyle choices that we make can affect some of these critical chronic diseases that exist in the world and allow us to change those or at least influence those so they don't affect our life as much. But one of the big factors that's actually not thought about a lot is the built environment itself and the way the environment is actually built to that the effects that those actually have on health. So in this picture, you could see that this is a location where you could walk across the street very safely in the middle of traffic to get to the other side to likely get to a fast food restaurant when you're there, that's there. So when you think about building and designing communities in this way, what does this mean and how does this actually impact the environment around you? The way it impacts the environment is pretty devastating these days. It's really of epidemic proportions. The Center for Medicare and Medicaid has said that in 2018, we spent $3.6 trillion on healthcare in the United States, which is a little over $11,000 a person that's being spent on an annual basis. About 40% of adults and 18% of children are considered obese that are there. A lot of this is because of life choices and behaviors that we have. But an interesting fact is you could save $5.5 billion in healthcare costs if 1 in 10 people just started walking 1 to 3 times a week that are there. It's tremendous through the statistics that you look at the data of the actual effect that could have on the health and the cost of healthcare. Physical inactivity and unhealthy diets are second only to tobacco use with causing that. So being a person that gets on an airplane now 3 days a week, that's there, travels around the country, eats in a lot of airports where there's a lot of fast food available for you, I'm not the picture of health, quite honestly from that. I've lost about 40 pounds since I had a heart attack 7 years ago that were there, and I'm trying to improve that, and that's one of the reasons I'm kind of living this now. But I've been looking at how we could actually affect and change what we're doing in communities right now, because what we're doing is actually reinforcing these chronic behaviors that exist. If you look at some of the behaviors that are changing right now, back in the 1970s when I was growing up at the time, the population under 18 in urban areas has now increased threefold. So 3 times as many people are now living in cities. 3 times as many children are living within about a quarter of a mile of a school that they go to right now. But if we look back at the statistics, when I was 10 years old, 66% of children walked or biked to school in 1974. Last year in 2019, only 10% of those children, with the massive growth and the movement of people to urban areas, they're not taking advantage of that. What happens because of that? There are a lot of consequences that happen that are there. The map that you could see that's on the upper left area is looking at adult obesity in 1995 compared to adult obesity today. If you notice, there's not a lot of green left on the map across the country. 30% of adults in the states in the US are now considered obese that are there in half the states, sorry. In addition with that, diabetes has also become an epidemic as well. In all but 5 states, 8% or more adults now have diabetes that are there. So kind of stepping back and thinking about this, we had to look at, well, what's a potential solution to this? How can we improve this? Really, the way I think about it is public health is no longer solely the business of health professionals anymore. It's everyone's business now to think about this, be educated about this, be aware about this, And what we could do is try to change things. And the way we change things is through prevention rather than treatment. So part of prevention, as I mentioned, physical activity is a big part of prevention from that standpoint. So designing communities where we actually have that opportunity to have prevention, have where areas that we could use and we could walk and we could run and we could enjoy nature at a time will make a difference. We've been able to show through data that the relationship between the built environment and health is directly related to each other. It correlates quite well. So what does the data and the people say? Well, there is a very strong connection between transit-rich communities. So I've heard a number of people talk about providing biking and walking capabilities within communities and better health outcomes. From an economic standpoint, healthy communities have better economic development efforts that are going on, or vice versa. There's a little bit of an argument in this area, is it a cart or a horse, that are here when you think about this area itself. But the data does show that if a community is healthier and we strive for a healthier community, it will be more economically prosperous. But there are also other opportunities for health that influence what people want in their community. So as we talk about community outreach and go out and talk to people, I don't think anybody in this audience would say, I don't want to live in a healthy community. I don't want to be part of a healthy community. I don't want my kids to go to a healthy school and eat that. We all feel that way, but are we actually taking actions that's making that happen? One of the people that we're doing a lot of work with is Dr. Richard Jackson from UCLA. He's very well known for talking about healthy community design. And what healthy community design is, it's actually taking the principles of health. So there's a state of well-being. It needs to be complete. You need physical, mental, and social well-being. And it's not merely about not having disease that's there. So how do we actually move that forward? Well, healthy community design is planning and designing our communities in the built environment to make it easier for people to live healthy lives. So not only giving the opportunities, but giving them destinations. There are a number of different areas that I could talk about in these. Some of those I've mentioned before. But what we've tried to do is take these 10 principles of healthy community design and actually build them in and leverage technology now. So we could use open data and GIS technology to combine those together to build a model that would allow us to create a baseline of where we are today and predict what the outcomes would be if we keep doing what we're doing right now. We analyze land use, urban design, mobility factors. We establish the baseline and projections of if you do this, this will be the result of what's happening. We forecast these effects, and then we work to try to educate and prioritize to make improvements that will actually improve the conditions that exist today. One of the biggest challenges we have is data that's there. We've talked a lot about data, the security around data, but there are a number of different data sets that are out there. There's ones we need to make this make sense. And when you think about what impacts health, there's a lot of things: where you're from, how much money you make, your cultural background, your marital status, your job, your race, your family background, your age, your social networks, your sexual orientation. The moral of the story is everything affects your health right now. So we have to be conscious of this, but it's interesting that not a lot of people are talking about this. One of the things we were able to do is there's a data set that was created about 5 years ago now called the 500 Cities Data Set. It was a cooperative between CDC and the Robert Wood Johnson Foundation. It gives census tract estimates for chronic disease factors for 500 cities, and it's been going for about 4 years. The data is updated. We were able to take that data, combine that data with census data, and then pull in other open data sources that are out there, where transit stops are, where grocery stores are, ratio of sidewalk miles to actual miles, off-street, on-street parking, crime data, street lighting data, into a big data environment, and use that to actually predict what outcomes would be. We've then taken this on the road. We worked with Dr. Jackson that I mentioned. We worked with Leslie Meehan, who's the Director of Planning for Tennessee Department of Health, who has gotten Tennessee to actually build health into their regulations so that projects that get funded only get funded if they have a positive health outcome. We've ran workshops around there. And in the end, we built a mobility model that has allowed us to take that 500 cities data, expand that data out so we could actually expand it and fill all the gaps within those 500 cities to predict what was going on with health. Build an application that allows you to actually assess health characteristics. So if you actually change something and do something, what will that effect be? And then we've been testing it on very granular small sites now to actually see what those outcomes could be. There's been some very interesting results that we've come out of this. We're going to be publishing some papers that describe what this is. But some of it goes around the combination of factors that exists in the world itself. So if I have a good destination to go to that's a health food store versus a fast food store, when I get there, it's probably going to actually make me a healthier person. One of the other common themes that we're seeing, which is sort of like an aha moment, but of course it makes sense, is if you have high crime data and bad lighting at night, even though you have sidewalks and parks and bikes and trails, people aren't going to use them if they don't feel safe. We could actually show that through 5 years worth of data now of what's changed and what's happened. So in summary, health is an important issue to consider when we design our built world. Make sure your decision makers are thinking about health in their process that they're putting in and make it part of the process. And it's important that it's a combination of factors that actually affect what's going on. So, thank you.